All right, guys. Today we're going to talk about a exciting player that kind of changed the game last year, a little surprising for the Steelers. Juju-Smith Schuster. Now, the crazy thing about Juju is that he's only 21 years old. I mean, it's crazy. He's a baby. I mean, most guys don't excel this early, this fast. You know, most guys are in their mid to late 20s, start seeing 30s, and you have father time, as I like to call him, Tom Brady, pushing 40, and Vinatieri and a couple other guys. But 21 is young. Good for him. It means he'll heal faster. So, what do we know about him? He's on the Steelers, obviously. He was drafted in 17. He had a pretty solid season. In 18, he's projected for 66 receptions, 908 yards, and 7 touchdowns, which would put him around the 19-20 mark for Fantasy Pros for 2018. Check something real quick. All right, so in 2017, Juju played 14 games. He caught 58 passes for 917 yards, an average of 65.5 yards per game. Very impressive. He caught 3 games with over 100 yards and 7 TDs. Very, very respectable. He also chipped in another 240 kickoff yards with another TD there. So here's my thoughts on Juju this year. So he suffered a couple injuries last year that you don't really think about. One is, first off, rookie wide receivers usually don't do well with in the NFL. At least whether it's the talent around them is a lot better than they're used to in college, more consistent. Whether it's the learning curve or whatnot, the grind, the wear and tear, the pressure, I don't know what it is. But, we know running backs do really well, which is why Saquon and a couple of the other guys, Royce Freeman, a couple, Rojo, have strong potential this year because of that. Last year, Hunt went bananas, Fournette went bananas. So, obviously, the rookie running backs are doing quite well, but the wide receivers usually never really do as well. There's one or two that will kind of rear their head and whatnot. So last year, Juju was that guy. Him and Cooper Kupp both played really well, enough to actually make a name for themselves, and they were startable every week. So I borrowed this line from the Fantasy Guru Elite Draft Guide. Juju helped make his QB a total of 134.0 QB ranking on passes thrown his way, the fastest in football, the highest in football. So that's, and that's the highest mark since 2007. That's crazy. That's amazing. At the same time, very likely to be unlikely to be repeated. Now, he ran 60% of his slot routes from the slot, which is another impressive feat because there was a couple guys ahead of him, which we'll talk about. Now, he did not drop a single pass that was, there was 27 that were considered catchable. So that's, that's pretty hard to repeat as well. So he's 6'1", he's 215, coming out of USC. He ran a 4.5440, and he was basically Sam Darnold's go-to guy at USC. He averaged 14.5 yards per catch over his 3 years in college. So we know he had beast potential. So, and last year, he was only 20 when he did all this. He turned 21 in November, so he'll be 22 in this November. So I mean, it's fantastic what he's doing this early. So let's talk about his first injury he sustained. Preseason concussion. Okay, so this was the preseason opener, and definitely not a good start to his NFL career from an injury perspective. As we know, obviously very concerning for a concussion. So I deal with concussions pretty regularly, and I predominantly really only do sports concussions by preference. So let's talk about concussions a little bit. So coming back from a concussion, each concussion is completely different. Why? Because it happens in different situations. Our brains are uniquely wired. Maybe yours was a big impact from a car accident. Maybe it was getting smushed by two players. Different locations. Everybody has different symptoms. The headache is by far the most common symptom, about 70%. Dizziness is very common. You can have irritability, depression. You can have really bad vision issues and slowing of your eyes. So difficulty tracking, like if you're driving, you see cars next to you, you can't catch them. You're not sure if they're going by you or where they are in line. That can be challenging. A lot of people. I had a girl recently who was a really high-level gymnast, and after her concussion, she couldn't even stand on one foot. I mean, this is a girl who's doing, flips and balance beams and all this stuff, and she couldn't even stand up straight with one foot. I mean, so sometimes they're underappreciated how significant these symptoms are. So take that into consideration when you hear that these guys get a concussion. So here's the thing, though. So this must have been a really light concussion because he came back in 3 days. Now, we have a pretty standard protocol for concussions. Usually the first day, you shut it down altogether. I recommend my people shutting it down for probably at least 3 days. And then from there, you consider kind of ramping it up. As my nose is super itchy, sorry. Then you start increasing the protocol slowly. You'll kind of ramp up day one to get the heart rate when you're cleared to start. Get the heart rate going a little bit. Then it goes a little bit more, and then then you start doing some sport-specific drills. So wide receivers, run a couple routes or something. Then you finally get cleared for pads. Each of these usually takes a day, and if there's any symptoms during that time, then they start from scratch, and they have to start that level over again. Usually after a day or two rest. So as fast, I'd say it's like 3-4 days. That's like the fastest you could pretty much do it in if you're sticking to the protocol, and you're honestly, truly on the protocol appropriately. Now, but I've seen them take months because the person just can't break a symptom. Their headaches are coming back. They have certain issues with eyes and vision and stuff like that. So very, very concerning stuff. Whenever you hear of a concussion in the NFL, and they're super common, that's the issue with them. So another thing is that when you have a concussion, you are 6 times more likely to get another concussion, especially in the next 90 days. So obviously these guys are going to continue to play once they can. So you're at increased risk, and I'll talk about it in a little bit. You're almost so likely to get another concussion. So he also happened to have a bone bruise in his knee, which we know through Sam Bradford, super painful, okay? And they last a long time, 6 months to a year and a half. So the good news is that as Juju got back on the field, he was starting to see more and more snaps. So by week 5, he basically took over the slot position. And Martavius Bryant, he started over him, and Eli Rogers, he was starting over him. So Juju basically caught 2 passes and scored a touchdown in week 7 over the Bengals. But then his name popped up back on the injury report again. So this time, another concussion. So as I just said, he's at high risk for another concussion, especially in 90 days. Well, it wasn't 90 days, and he already suffered another one. I mean, you got to remember, he's a slot receiver. He's going to get hit often. It's not like he can, a little curl route and then run out of bounds. Like, he's gonna get hit. So, a lot of this stuff is frustrating for a player because there's really not that much they can do about it. 70 to 80% of concussions, sports concussions, resolve within about 14 days, 7 to 14 days. A little bit longer for kids. Now, but like 5 to 10% of them last over a month. And then you enter what we call post-concussion syndrome phase. So it's obviously anybody's guess. I mean, sometimes you can tell, or I can tell, by early if this person's going to have a long recovery or not. And it's almost like my hands are behind my back when I'm trying to treat them because there's only so much I can do. I mean, like, I can replace your knee. That's easy to do. That's straightforward. But I can't replace your brain. Like, I can't. So we only can do what we can do. There's an issue in the brain where after a concussion, where it doesn't get the appropriate nutrients, the glucose it needs. So when you start ramping up your activity and you get your heart rate up, that lack of energy makes your symptoms worse, which is part of the disconnect. So you need to give the brain time to properly heal and to properly allow the hormone levels to kind of fluctuate and go back to normal. And that's what a lot of the symptoms are about. Now, a lot of the times, we used to use a scale to kind of grade these: mild, moderate, severe, like kind of really severe. We don't really use that anymore. And basically, I'll ask a patient if they've ever had one, and then B, if how long it took them to get back to normal. Like, when were you 100%? I'll literally have them give me a percentage. Like, what are you today? I'm 70% today. All right, well, what's the other 30%? What's making you not be 100%? And kind of go from there. So how do you treat concussions? So I mentioned a couple things. PT usually works really well depending on what's going on. Guided therapy, sometimes vestibular therapy or ocular therapy. We have little crystals in our ears, inside of our eardrums, kind of deep in, that control our balance and our kind of motion. And when these are sometimes really thrown out of whack with an injury, it can cause a lot of issues. Sometimes these can be hard to reset. People almost look like they're drunk, but they're not. That's the issue. It's vertigo, basically. So we can use that. Sometimes I'll request the help of a neuropsychologist who can help tease out whether some of the symptoms, whether it's depression or anxiety or something like that, or focus issues, are from the concussion or are from like stuff they had before the concussion and now they're just stronger. So sometimes you can have that. Sometimes we have to use medicines like Adderall, and we have a couple others if the fatigue is really bad, if their focus is really bad, and even sometimes if their neck is out of alignment, what we call the dens, the top part of the neck, only by a millimeter or two, you can have really bad concussions and symptoms. And this is actually what happened to Sidney Crosby, the famous hockey player. He actually, his neck was just out of alignment, just enough where he actually had to get readjusted. And once he was readjusted, his symptoms improved significantly. So sometimes it's trying to figure out what the symptoms are and what you can do to help them. So the good news about Juju is that he was able to return in about 7 days, which is fantastic. That's best case scenario in my opinion. And he had a monster game, catching 7 passes for 193 yards and a touchdown. That's a ridiculous game. So then in week 12, another injury, this time a hamstring. So it was likely a grade 1, the least amount of inflammation, least amount of issues. But this caused him to miss week 12, understandably so. But he was able to play 66 snaps in week 13 without injury or re-injury. So that's good. But here's the thing. After week 13, Juju was suspended by the NFL for one game for violating player safety. I have the info right here. He basically sounds like he pretty much leveled Bengals Vontaze Burfict with an illegal peel back block and then basically stood over and taunted him. So not a good idea. Either way, he was suspended for a week for this. That shows you a little bit of his age. And allowed his hamstring to heal up a little bit more. So kind of a benefit there. So all in all, he played 14 games in 2017. Very, very, very respectable rookie campaign. In week 15, the same hamstring injury, he had it, but it was probably improved. He managed to catch 6 passes for 114 yards in the loss to my Patriots. And then kind of something popped up in the offseason that we really haven't heard much about is this a knee injury, and we don't know anything about it. They haven't told us anything. So we'll see if that, what's going on with that, or if it was nothing. So here's the question I propose. Each week, I try to propose a question that somebody may ask about him. So is Juju-Smith Schuster at increased risk for sustaining another concussion compared to someone who's never sustained one? Yes. The data is definitely increased, and there's no doubt about that. There's a specific study that shows there's a 3-fold increase in people who sustained at least 3 concussions over a person who's never sustained one. And here's the concerning part, though. These concussions, each one is usually worse than the previous one, and it usually takes longer. So obviously not ideal. So overall, here's my 2018 health outlook for Steelers wide receiver Juju-Smith Schuster. He had an impressive rookie campaign, there's no doubt about that, despite being limited by a couple of injuries. Both of the injuries he sustained are concerning. I mean, I talked about the concussion at length, and the hamstrings are always concerning. They derailed Corey Davis's rookie season last year because of it. But then you can have someone like Odell, who had 4 games early in his career, and then we haven't really heard about any hamstring injuries since. So obviously concerning for some people, for definitely concerning part. Now, the concussion actually concerns me more. Why? Because he's a slot receiver. He's going to get banged up hard. It's almost inevitable he's going to get sandwiched pretty good, and now he's at increased risk. And the thing about concussions is they're so unpredictable and they're ubiquitous. I mean, we see them everywhere. I feel like there's at least a couple of concussions every game, and now you can't slide through and say, oh, I didn't know what I was dealing with. Everybody knows what a concussion is now. So his risk, he's pretty high risk for getting another one. I put him at like 70% chance for seeing his name on the injury report sometime this year, with about another 20% chance for repeated concussion. So the good news is that he heals fast, he's young, and he's got tremendous upside, and he's got a pretty respectable quarterback going for him and whatnot. So here's my recommendations for drafting Juju-Smith Schuster in 2018, or considering trading for him if you've already drafted. So here's the thing. You're paying top dollar for a slot receiver who's the second best wide receiver on the team. AB is obviously number 1 in the league, in my opinion. And if you consider Bell, he's basically third. So I'm not going to pay top 20 prices, and he's going at number 20 right now, for a guy who is the third best wide receiver on his team. If AB goes out, if Bell gets banged up or contract or whatever, then that's a different story. But I'm not drafting him as a 20 wide receiver at the 44th pick because of that. There's just too high risk for me. So, I mean, that's basically end of 3rd round, early 4th round, depending on how big your league is. I want a guy who's going to be the number 1 wide receiver on his team if I'm drafting a wide receiver at that level, at that spot in the draft. I want a go-to guy. I want someone like a Corey Davis that I just mentioned, who I think is tons of potential. Brandon Cooks, I'm pretty high on this year. Hogan, even though he's technically not the number 1, I think he's going to be solid. So these are guys that I would look at personally instead of him. So I'm fading him altogether between that and between his concussion history. And that'll just be enough for me to fade him. So that's all I have for Juju Smith-Schuster. Thank you for listening, and if you're on the watching, I appreciate you watching this. Also, do me a favor, hit subscribe to the podcast, to my YouTube channel, to wherever you're listening on. I'm on most of them, the mediums nowadays. Leave me a 5-star review. I appreciate that. More that'll give kind of bump me up the iTunes list. Stay tuned for more episodes. If you have any questions, comments, concerns, you can leave it comment below, or you can shoot me an email through my website www.drjessemorse.com, or hit me on Twitter if you're on there at Dr. Jesse Morse. And we'll see you next time. Take care, guys.